All right, good morning. We appreciate you taking time out of your day to join us. Before we get started, I just want to cover a few housekeeping items. This webinar is produced by the Underserved Victim Populations Project, a project of the Center for Innovation and Resources. Funding for this project comes from the California Governor's Office of Emergency Services, Victim Services Branch, with funding made possible through the United States Department of Justice Victims Crime Act. For those of you who can hear me, this might seem obvious, but I just want to remind you to turn on your speakers in order to hear the presentation. Use the Q&A feature to ask the presenter any questions that you may have. We will begin with the questions that were emailed in prior. You can use the chat panel to ask any tech support questions, and those questions will be answered immediately. Now I'd like to introduce our presenter, Dr. Katie Pedgrift. Dr. Katie Pedgrift is the creator of Relationships Decoded. She is a licensed clinical psychologist at North Bay Regional Center. She earned a special education teaching credential from San Diego State University, her master's degree in special education from San Francisco State University, and her doctorate in clinical psychology at Alliant International University. She has worked with people who have autism and other developmental disabilities in a variety of contexts, including forensic settings, inpatient and outpatient settings, schools, and diagnostic clinics. Dr. Pedgrift has authored numerous curricula designed to increase knowledge and self-protection behaviors in people with disabilities, including the Array of Colors curricula, Abuse Awareness and Prevention, Sexuality, and How to Be Fire Safe. So now that we have introduced Katie, she also has some colleagues that she has on with us today who helped co-create Relationships Decoded. So I'll let them do an introduction.
Again, maybe I can introduce them. Well, I can see all three of them right here. So I brought with me the co-creators here of Relationships Decoded, and the four of us together have been, working on this education project for the last 3 years. So I have Maurice Travis here. He's a marriage and family therapist who's been creating this project with us and pilot testing it in a variety of contexts, including day programs and in one-on-one counseling situations. I also have Mary Champion, who's also a marriage and family therapist and a school psychologist, and she's been pilot testing this program in school settings. And I have Georgia Pedgrift, who has really coordinated this grant and done a lot of work managing all of the volunteers who have participated in this, and including our volunteers with developmental disabilities. So I'm confident that between the four of us, we can answer any questions that you guys might have.
All right, perfect. Thank you. So yeah, we'll jump right in with the questions that were emailed. But again, if you have any questions as we're going through these ones, you can either put them in the Q&A or you can put them in the chat. So let me go ahead and get started here. So a main question was, how do regional centers obtain this curricula?
So, regional centers are really encouraged to use this program as much as possible. This was created through funding from the Department of Developmental Services, that's the agency, the state agency that funds regional centers. So we definitely want regional centers using this. And if any regional center is interested, I would personally train any staff who's interested in doing it and support them, provide them with any kind of ongoing support that they need. They can access the curriculum for free on the website now at Relationships Decoded. Em, is it possible that I share my screen to show folks that?
Yeah, definitely. If you, on your controls, you should have the share screen button.
Let's see. I do, and it doesn't look like I have Relationships Decoded up. Okay, so
here, let me see. I can share it on mine as well.
Thanks. So anyone can access the curriculum right from Relationships Decoded, so folks can take a peek at it. Thank you, Emma. And so right under the curriculum tab, anyone can access all of the material right now. But really, if there's any regional center that's interested in doing this, I hope that they would contact me. They can contact me directly, and they can also contact us through Relationships Decoded. When someone sends an email through the contact button, all four of us get that email, and one of us will get back to people right away.
Okay, perfect. All right. And our next question was, how young do you start these conversations?
These are tricky conversations to start. And probably different forms of the conversations start at different ages. I would really encourage parents to be having conversations about privacy and about good touches and bad touches, public and private places, really at a young age before you're even starting to talk about relationships in general. And then I would start talking about relationships in adolescence or when people become curious.
Great, thank you. And our next question was, is this program being adapted for younger folks? I know a lot of youth sex ed is trying to be more inclusive of different abilities and identities. Are there, and then kind of a two-parter, any potential partnerships or collaborations?
Yeah, so we're excited about the prospect right now. Actually, the four of us have made another proposal to the Department of Developmental Services to develop a middle school and high school program. And we're a little delayed with all of the funding crises in the state right now, but we're very optimistic that we're going to that we'll start developing that material this year.
Great. All right, let's see, our next one is, how much information or detail do we use with students that are nonverbal with a significant learning disability? And then, do parents have a say in what's presented to their child? And then, are there any age requirements?
So the program that we've developed right now, Relationships Decoded, is a program for adults. So we talk a lot about adults being in relationships with other adults. Adults cannot be in relationships with children. So this program itself is really targeted at adults. That being said, I think that there are parts of it that a parent could look at and really want their younger adolescent or teenager to have access to, and certainly parents can do that. In school settings, and Mary, you could probably talk about this too, parents do have a right to what education their children can have access to.
I can kind of jump in there if you want, Katie. So in the school setting, I primarily use this curriculum with our transition population, which is 18 to 22. So for those students who are conserved either by their guardian or their families, we did provide an opportunity for families to preview the curriculum and give us permission or not to teach this. And so if your school system does decide to offer this, that is typically the standard, that you have an opportunity to opt out and to preview and say what parts you may or may not want them to participate in.
Okay, great. Let's see, the next one, is this program being translated into any other languages?
Oh, I wish I had a better answer than the answer that we have. This has not been translated into other languages at this point. We have had a couple providers present it in Spanish. Of course, the videos, though, are not in Spanish. They're not dubbed in another language. So we don't have it in another language. And we don't have the videos translated either. That's something I do think is important. And I would love to have that as a future goal.
Great, thank you. Then just a reminder, if anyone has questions, to either put them in the chat or in the Q&A. I did get one. This webinar is being recorded and it'll be on our website. So yes, you will have access to that. Let's see, in our next question. So I'm hoping to hear more about the effectiveness of the program. In the 20-minute talk, Dr. Pedgrift mentions a collaboration with UC Davis and the Mind Institute. Have you guys examined the effectiveness, and will it be published?
So yes, actually, they did just finish their kind of comprehensive program review of our project. And we were actually just talking about it before we got started, that we will post that on our website. And so we'll probably have it under frequently asked questions, you know, is this effective? Has it been tested by a research agency? And then we'll have the link to the article that was written. And I know the question had asked if this is going to be published, and that's definitely something that we're working on, because we were really, really pleased and excited about the results. Some of those being that people do learn from participating in this program. They learn more information about sexuality. They learn more information about what abuse is, and more information about what the laws are of social sexual behavior. And we know that having information like that is a protective factor of sexual abuse. And it also facilitates prosocial behavior. So we were really excited to see those increases in knowledge after participating in this education.
That's great. Awesome. And I've put the link to the website in the chat for anyone that would like to check out their website. So let's see, our next question is, I'm curious about whether this is intended for group or individual use. And if, well, you kind of already answered the second part, if there's parent involvement.
Yes, so we've actually done both. We've done groups and we've done individuals. As a general rule of thumb, I do think that the group is best. It's an ideal situation where people can learn from each other, people can make connections with each other. We've had people develop relationships, we've had people develop friendships. And so I think that that's been a really valuable part of this education. And I also think that there are people for whom it's more appropriate to do it one-on-one. And that could be situations in which people have experienced some trauma and might really need for some of the material to be gone through quickly or not gone through at all because of their own personal experiences. Maurice might be able to talk a little bit about this because he has done probably the most work in individual settings as a therapist for people who might need to access the relationship in a more private setting.
Yes, indeed. Yeah, I mean, I think it's useful either way, but like Katie said, you know, there may be barriers that kind of come into play as far as individuals accessing it in a group setting. Trauma is definitely one of those barriers. Anxiety is another barrier. You know, access to just access to the community settings. I've worked with individuals that use wheelchairs for mobility, and so they may not have the access to be in a group setting, and so those are some things. Other things, behavioral issues as well can sometimes come up, and you know, having a one-on-one session may be a little bit more conducive to kind of diminishing some of that stimuli that kind of happens in a group setting. But I've found that it's been effective in both settings. Actually, in the individual settings, I've actually had experiences where we've taught the lesson plans, and clients have actually come up and realized that there are situations where they have been victims of certain types of abuse and situations like that, and made reports after the lesson plan. So it's been very effective in both settings. It just depends on who it is that you're working with.
And I think there might have been a second part with parent involvement, Emma, in that question.
Yeah.
And so for the curriculum that we have now, we have not allowed for parents or guardians to sit in on lessons and to be a part of it. We've really been, advocating for this as adult education for adults. I think that that will change when we start working with adolescents and preteens and teens. Then we will include a parent component. And some of that could include talking about what privacy is and how you have privacy in the house. What are the privacy rules in the house? Talking about private body parts and what that means in a home and outside of a home.
Great, thank you. And I'm wondering if you could talk a little bit about the process of someone getting the videos. So I had someone ask, they sent in an email request. So is there like a waiting period, or what's the process once they request?
Yeah, so there's no waiting period. There's you can actually get them right now directly from the website. And so when you go to the curriculum tab, you'll have two options. One will be the lesson plans, and then the other will be the visual supports. So the visual supports include all of the pictures and all of the videos that are a part of the lesson plan.
Okay, perfect. And let's see, I think we had another one in the chat. So someone wrote, from the preview video, it looked like the videos and visual tools were inclusive of diverse races, ethnicities, sexual and gender identities, and orientations. Is this the case for the whole curriculum?
Yes. So, one thing that we tried to do was look at the demographics of California and then do the best job that we could to match those demographics as far as race and ethnicity is concerned. And then we also looked at the population that we're teaching. And so, we're really teaching people who have intellectual disability and people who have autism spectrum disorder. And there is much greater diversity among people with autism, especially in their gender expression and their gender identity. There are higher rates of asexuality, bisexuality, and gay and lesbian identities. So we really made a special effort to include that into the curriculum so that all of our students can see themselves.
That's great. Thank you. Let's see. We had another one in the chat. It's a bit of a long one, so I can repeat it if you need. So we had someone write, I evaluate adolescents at the Public Defender's Office. I often testify and argue that lack of sex education for people with disabilities has led to the transgression. The kids I evaluate, ages 12 to 18, simply do not understand the rules and have never been taught what is right and what's wrong. Often they can't really even talk about their bodies. So do you have any information or statistics regarding like baseline knowledge of sexuality with this population?
I'm sure there's been more in-depth research. We did do, and Georgia might be able to talk about this, that we did interview 50 people with developmental disabilities prior to starting this project in order to get that kind of baseline about their interest in relationships and their previous experience with relationships. And we did find that, and you probably have the exact number, Georgia, about the number of people who had ever participated in sex education or relationship or class about relationships.
Yeah, I think only 40% of the adults that we interviewed had ever taken a class specifically around relationships, which meant 60% hadn't. And these are all, again, 18 and older, so people who have who've gone through school and still never having received any of that information. And then we did find a direct correlation between the number of people who were interested in relationships and having one and the number of people who were interested in taking our class specifically. And it was about, was it 80%
or 85%
were interested in being in a relationship. And that curiosity and interest led them to be much more interested in participating in a class like the ones that we offer.
And when you have that discrepancy of people who are interested in having relationships and not having any prior knowledge about it, you're inevitably going to have people who are demonstrating inappropriate social sexual approaches. And you find that it's very common. And you also find that folks can interact with the legal system because their approach was really inappropriate and maybe even illegal. So I hope that we answered that question.
Yeah, I'll let you know if there's any follow-up with that as well. Let's see, our next question, we have the website as well as the curriculum is very user-friendly. Given the current environment, can these lessons be facilitated online?
I think that they can, yes, because I mean, you can do a share screen. We actually have a psychologist who is going to be starting to do that maybe next month in the Solano County, Napa County area. And the four of us have actually been talking about getting some started, one with school-aged youth when school gets started, and with just adults who are interested and might be able to navigate a device, a mobile device. So yes, we've been talking about trying that out and seeing how it works.
I add something. I recently started doing a curriculum online with one of my clients through Zoom and with the shared screen. It works well. It works really well. And so started doing that on lesson 2 so far. So I'll give you some updates.
Oh, that's great.
Mm-hmm. All right, let's see, we had one come in. So can anybody pick up the curriculum and effectively teach it? And then I know you kind of talked about this a little bit already, but do you already have examples of people successfully using it?
So all of the pilot testers that have used it have been professionals. So the people who have pilot tested the material are therapists, psychologists, teachers, and BCBAs, so people who are behavioralists. And those are the folks that I would recommend using the curriculum. Some of it is because I would recommend some kind of background in evidence-based teaching practices, because those are definitely infused into the program, and have a plan. If they don't feel comfortable addressing it themselves, at least have a plan for recognizing symptoms of trauma, because it's very, very common among people with disabilities that they've experienced some trauma, and have a plan to refer them, have access to a resource to refer them to a therapist or someone who can help them address that.
And additionally, on our website, under the curriculum tab, you'll see that there's a facilitator's guide. So we highly recommend that you read that, you look at our frequently asked questions, and then completely review the lesson plans before you begin. And so hopefully that will give people information to decide for themselves if they feel equipped to instruct on this curriculum.
Great, thank you. And again, I just want to remind people, because the time goes by so fast, so we only have about 6 minutes left. So if you have any last minute questions that you'd like to ask our panel, go ahead and put them in either the chat or the Q&A box. So I think we have one more in the Q&A. Let's see. While the curriculum focuses on educating individuals with disabilities, do you have resources or trainings for service providers and the public to address stigmas of disability and sexuality?
We don't have anything that specifically addresses some of the stigma issues. We don't have that on our website, and it hasn't necessarily been included in this education program. I do think it's a relevant issue and resources that people should have, especially when they're out in the world and experiencing some kind of discrimination through the expression of their sexuality. That's definitely a resource that we have yet to tap into.
And then I just want to I'll put it in the chat box as well. CIR does have some webinars that you can use as resources. I think some that Katie's done with us before. So I'll put that link in the chat box. And let's see. Okay, the next question was about the website. I'll go ahead and post the website in the chat box again as well. So the next one would be, how do I work with a youth with an IQ of 63 or below for a screening? Or how do I know if the youth is processing or comprehending what's going on in the session?
I mean, a youth with an IQ range in the 63 range is definitely representative of the people who we teach this class to. And so definitely the information that you would be getting from like the Mind Institute with pre-post testing would definitely be valid for that individual. I do think sometimes in conversations you might have to do some checks throughout the curriculum to make sure that that individual is understanding what's going on. We do have the web application too that gives people an opportunity to assess individual learning. So if you did watch the webinar, you could see that, how to access that. And that also is available directly through our website.
And I think it's important to remember that this curriculum wasn't necessarily designed to be a one and done type of program. There are definitely participants who might benefit from repetition or engaging in the curriculum multiple times and perhaps in different groups. So that can always increase the learning knowledge for participants.
Absolutely. Yeah, I wouldn't anticipate anyone to go through it once and then have mastery level comprehension of everything that we've covered.
Okay, great. Let's see. Let me make sure I'm getting all the questions here. So you may have an answer for this. Someone said, I'm interested in issues of financial exploitation of those with intellectual disabilities. Do you know of someone who could help or possibly do a training on this?
Yeah, I mean, financial exploitation is definitely a significant issue and a type of abuse that is common among people with developmental disabilities. That's not something that we addressed in our curriculum. I do think that SEEDS Educational Services, I think they do have some material and some lessons on that are specific to all types of abuse, including financial abuse. And I think at seedseducation.org or .com, I think it's a .org, you could probably access material that addresses financial abuse.
And just to add, our curriculum does include information about online safety specifically, and that does include, we do have like one video in particular about being tricked into sending money, you know, to somebody that you think you're in a relationship with. Ours is always in the context of relationships, both friendships and romantic, any kind of relationship. But we do have a number of videos and information about vulnerabilities specific to the internet, which of course financial abuse is a part of.
Yeah.
Great, thank you. We only have about a minute left, so I think I will go ahead and do one last question. And if anyone else has any outstanding questions, you can feel free to email me and I can get you in contact with Katie or get you to whatever resource you could use. So let's see, given that there is so little understanding of how to support neurotypical LGBTQ adolescents and young adults, how do we approach parents of kids with developmental disabilities on how to support them? Unconditional positive regard is not realistic, nor is it truly what happens in a family. Does your curriculum help parents find ways to support their kids?
I think that is a great question. And to be honest, some of the professionals who pilot tested this curriculum found themselves not always knowing how to navigate that when we're showing material that shows diverse relationships and commanding a space that is respectful for all people. And so if it's difficult for us as professionals to do that, I can only imagine how difficult it would be for parents and other folks to do that. Regarding the parent support piece, I do think that that will be addressed when we are creating material that's specific for children and parents. For this curriculum, one piece in the very first lesson, one rule of participating in a group is that people have to be respectful of all relationships. And if people are unable to be respectful of all relationships, then they can't really participate in one of these groups because we too include a lot of diversity of relationships and gender expression throughout. And so that would be someone who might, someone who can't be respectful of all relationships might be better served in individualized education because we really can't tolerate that in a group.
Great. Well, thank you so much. The time went by so fast. So yeah, I think we'll end with that question. So again, thank you, Katie, for being on, and Georgia and Mary and Maurice. It was awesome to have all four of you on to give us more insight into the program. And then yeah, if anyone has any outstanding questions, you can email me. You should have my email, and I can get you in contact with Katie or one of the other panelists. And just as a reminder, because we've got a few questions, this is being recorded, so you'll be able to watch this on our website at cirinc.org. So,
and people are also welcome to hit the contact us button on Relationships Decoded and contact us directly, and we're more than happy to answer any other questions that might come up.
Yeah, so that link is also in the chat, relationshipsdecoded.com. And thank you so much again, and everyone have a good day.
Thank you, Emma.
Thank you.
Thank you.
Thank you.
Take care.